An outbreak of coronavirus infection started in Wuhan city of China in December 2019. COVID-19 has been declared a global pandemic by WHO in March 2020. WHO is a specialized agency of the United Nations responsible for international public health system. This video will cover coronavirus pandemic and its statistics. This novel coronavirus is a new strain that has not been previously reported to infect humans, although coronaviruses are a large family of viruses and known for causing several infectious diseases ranging from common cold to respiratory infections in animals and humans. A pandemic indicates an outbreak of disease that spread to cover the entire region of the world, resulting in massive loss of life. The COVID-19 outbreak started in different countries at different times, and now those countries are at different stages of pandemic. Since December 31st, 2019, till date, millions of confirmed cases of COVID-19 have been reported, including more than 75,000 deaths. Till date, COVID-19 has reached more than 186 countries and territories globally. Most affected countries are USA, Italy, Spain, Germany, China, France, Iran, UK, Japan. Global impact of COVID-19 is tremendous. During the past few weeks, there have been steep rise in death rate. However, good news is thousands of people are also recovering without having any critical illness. In response to combat COVID-19 outbreak, countries have been activating national plans to ensure that health systems are prepared to combat this new virus. Many countries have across the world introduced strict lockdown measures. Businesses are badly hit, economy is slowing down, but saving life is the utmost priority at this moment. Governments and leaders are taking bold steps in communicating the need for strict lockdown to ensure the implication of social distancing. The lives of millions of people are undergoing radical changes during this lockdown period. COVID-19 is a contagious viral infection spread through inhalation or ingestion of viral droplets as a result of coughing and sneezing. Even just a few coronaviruses can cause critical illness. Touching infected surfaces can also be a primary source of infection. If you touch someone who is infected and then you touch your face, mouth, nose or eyes, viruses enters your body and starts its journey down to the lungs, where it can have the most dramatic effect. The majority of infected people will get relatively mild symptoms, but many cases become severe or even critical. We have very limited information, but in general, a virus consists of genetic material, RNA or DNA, and is surrounded by a protein shell envelope. Viruses need a host cell to survive or reproduce. The lungs are lined with millions of epithelial cells that protect our organs. These are the border cells of our body organs. Coronavirus. The main symptoms of COVID-19 are dry cough, fever, shortness in breath, nasal congestion, running nose, sore throat, or diarrhea may also begin gradually. There are two features of a pandemic like COVID-19, fast pandemic and slow pandemic, that depends on how we all react in the early days of the outbreak. Fast pandemic will cost many lives. In worst case scenario, the mortality risk is higher for older populations and those with underlying health conditions such as cardiovascular diseases, diabetes, and respiratory diseases. Recommended precautions are similar to those for preventing the common flu. This includes washing hands regularly, social distancing, and following good respiratory hygiene practices. Avoid close contact with people who are sick. Cover your mouth properly. Disinfect surfaces. Avoid traveling and stay home. There is currently no vaccine for COVID-19 and treatment is only supportive. Therefore, preventing transmission is utmost priority. Vaccines and clinical trials are ongoing. The course of history has changed drastically in last 3 months and we still do not know when this will end. This simply means neither getting infected nor infecting others. Stay home, stay safe.